What Medicaid expansion allows us to do is to reclaim $13 billion of our money. There's no federal dollars. There are dollars that we send to Washington. Reclaim it and help people who are disabled, mentally ill, addicted, and help them to get a life back too.
And it will keep Arizona's tax dollars here at home, rather than allowing them to go to Washington to be spent on who knows what.
Let me be clear. Refusing these federal dollars would not mean they wouldn't be spent. It just means that they would be spent to expand healthcare access in New York or Connecticut or Ohio or somewhere else.
In 2013, a majority of South Carolina's legislature voted to leave $11 billion of our tax dollars in Washington instead of bringing them back to the state to pay for health care for low-income workers. The money is available to all states to expand their Medicaid programs to cover adults living at 138% of the federal poverty level. That's about $16,000 a year for an individual and $32,500 for a family of 4. Our state's decision leaves more than 200,000 very poor South Carolinians without any options for health coverage.
It's a colossal blunder on the part of the state not to go with the Medicaid expansion. Think about who the people are that would be benefiting from the Medicaid expansion. First place, they're taxpayers. They pay sales taxes indirectly or directly. They pay property taxes. They may pay income taxes. These are basically hardworking, low-income people who need this coverage. They can't possibly afford it.
I worked hard all my life, so very hard. And you can't afford health care, you can't afford dental care. And I get sick, and I'm not needed. And I can't find nobody to help me.
You don't have to have lost everything to need help. I'm just an average person. I'm not any better than anybody else. I'm just an average citizen, and I think sometimes we're forgotten.
Unfortunately, in too many circles, public and private, there's the stereotype that those covered by Medicaid and other forms of assistance are those who are lazy, those who don't try to work or try to help themselves. And that's certainly not the case with my granddaughters and my daughter's situation. She works a full-time job, 40 hours a week, and just because of financial obligations is not able to purchase private health insurance.
Put yourself in other people's positions and have the compassion to understand that we've got to help these people. What I try to communicate to people is, first of all, it could be you.
If I'm sitting there as a small business owner, as I was for many years, if Medicaid expansion is not in effect, I'm worried about the cost shifting that's going to happen to me and my employees.
As a businessman, Bill Settlemeyer understands the financial pressures on employers who want to provide insurance coverage to their people but see the price tag pushed out of reach as the cost of treating uninsured patients is shifted to those with insurance.
I think that the failure to pass the Medicaid expansion is going to have a lot of unforeseen costs for small businesses as well as all businesses. But in particular, hospitals are going to lose over 7 years about $3 billion in reimbursements they would have gotten otherwise from the federal government. That means that they're going to have to make up that revenue somewhere else. It's going to be paid by patients. It means it's going to be paid by employers who self-insure or buy insurance coverage, be paid by employees, it's going to be paid by individual insureds. So by walking away from that federal money, the state has made a decision, we're going to pay that out of our own pockets.
Much of the research being conducted indicates that Mr. Settlemeyer's concerns are well-founded. Researchers at the RAND Corporation concluded that South Carolina and 13 other states will collectively spend $1 billion more on uncompensated care in 2016 than they would have if they had expanded their Medicaid programs. And Moody's Investors Services, one of the financial firms that ranks a state's creditworthiness, has warned that states that opt out of the Medicaid expansion but have a relatively high proportion of uninsured residents will be hit the hardest. South Carolina is one of those states.
And I think could hurt our economic competitiveness because we're going to be a state where this is an extra expense which raises the cost of business.
Researchers at the University of South Carolina Moore School of Business have calculated that bringing an additional $11 billion into South Carolina to expand Medicaid would create 44,000 new jobs, $1.5 billion in new income, and enough tax revenue to more than pay for the cost of expansion over the first 7 years. Without the expansion, we are leaving more than 200,000 South Carolinians in the shadows.
Any political leaders, legislators, others who really say that our low-income workers don't need health care coverage, drop your own coverage. Drop your coverage for your families, drop your coverage for yourself, because if they don't need it, why do you need it? What's the difference?
Insurance coverage is a big factor in determining who is likely to get preventative care, which can detect health issues early when they are simpler and less expensive to treat. According to the Harvard School of Public Health, increasing Medicaid coverage to low-income adults would reduce death by improving access to health care.
Time and time again, I end up seeing patients who are at quite an advanced stage of cancer, and I wish they could have been seen early on. Most of the colon cancers, majority of the breast cancers, if we detect them early, we can address it at very early stage.
Dr. Kasha Patel is a cancer specialist who is passionate about preventing cancer and detecting it at the earliest stage possible when it can be cured. He also believes that Medicaid expansion is an important way to save lives and reduce healthcare expenses.
And we can really prevent a significant number of deaths that we are not doing right now. And imagine a young person, maybe 40-year-old, who works hard but has no health insurance. Suddenly gets to know that he's got 6 more months to live because he had a colon polyp. When you look at detecting cancer at a stage when it's just one polyp, you probably would spend $2,000–3,000 in that patient's care. When you look at the same polyp becoming a full-blown stage for cancer, you're looking at spending about $100,000 plus.
Pastor Johnny McKinney strongly believes that we have a moral obligation to do what we can to help those who are not in the position to help themselves. While he recognizes weaknesses in the Medicaid program, he says there is no reason to ignore the good it does.
So while it's not perfect, it is a step, even if a first step, in moving us forward to take care of those who are vulnerable and on the margins of society. We don't just fund perfect systems. No one would argue that our educational system is perfect. It is a growing and developing institution and process, but I don't see anyone arguing we shouldn't fund public education. This is a public interest question, not just a political question, and we need to be sensitive to those who are vulnerable and at risk.
The good news, it's not too late. Our leaders can still expand the Medicaid program here in South Carolina. It's important that South Carolinians understand what Medicaid expansion could mean to our state. Please talk with your friends and neighbors about this issue.
Now, when you die and get to the meeting with St. Peter, he's probably not going to ask you much about what you did about keeping government small, but he's going to ask you what you did for the poor. You better have a good answer.